next speaker is Dr. Sanjay Modi. And Dr. Modi will speak on the topic of parallels between the Ayurvedic and homeopathic approach to treatment of diseases. Dr. Modi is a lecturer and at the CMP Homeopathic Medical College, Mumbai, and has over 30 years of experience in practicing classical homeopathy. And it'll be very interesting to hear these parallels between homeopathy and Ayurveda. So, Dr. Modi.
Namaste and a very good afternoon to all the distinguished people. My topic for today is parallel between Ayurveda and homeopathy. Maharishi's vision has made it possible to integrate all dimensions of health in real sense. TM and Ayurveda has blended so well at the hands of Maharishi that Meru happens to be an epitome, capable of delivering health in all its aspects. As a homeopathic practitioner and a keen TM advocate, I am here to highlight today the role that homeopathy can play in furthering Meru's and Ayurvedic Society's efforts in delivering health. As system of medicine, both Ayurveda and homeopathy have fundamental similarities in terms of defining the key parameters when treating their patients. Let's look at a few of this. The ancient Vedas elicits human life to have four purposes, namely dharma, artha, kama, moksha, for which arogya is needed. Arogya in Ayurveda is viewed as a balance between the doshas, digestive fires, dhatus, and with tissues and eliminations are normal, with senses and mind centered in the self and full of bliss. Hahnemann gives a very similar understanding of health as a harmony of vital operations in all parts of the organisms with regards to both functions and sensations, so that our indwelling reason-gifted mind freely employs this healthy living instrument for higher purpose of human existence. Another view that is important in Ayurveda is that of Prakriti. Prakriti manifests himself in individuals differently, depending on the interplay between the three gunas, sattva, rajas, and the tamas. The Prakriti is a unique combination of physical and physiological characteristics that affect the way each person functions. Individualization also happens to be one of the key requirements in homeopathy. Writes Hahnemann, it is essential for a physician to do strict individualization of the disease so that the selected medicine becomes the most appropriate specific remedy for that patient, for that disease. There are a number of factors on which individualization depends in homeopathy, especially the mind and the body. For example, if a patient comes to a homeopath suffering from migraine, it is necessary to know whether the headache is brought on by any emotional disturbances, and if at all there is any, what sort of an emotional disturbance was it? Was it fear, fright, anxiety, or grief, sorrow, sadness, or anger? What sort of a headache it is? Is it right-sided or left-sided? Is it worse or better by pressure? Is it aggravated or ameliorated by light, by sound? Is it better or worse at any time of the day or the night? And each of these modalities, the remedy differs. According to Ayurveda, Prakriti is capable of being influenced by Dincharya, Ritucharya, Ahar, Vyayam, Swasthya, and Parasparik Prabhav. Writes Hahnemann, the human constitution is capable of being influenced by the climate, the particular natural conditions of the place of habitations, diet, human passions, various morals, customs, and habits. I think this is the reason why I chose to come here for the International Ayurvedic Conference. I find that both systems of medicines are holistic and individualistic. The objective of Ayurveda is twofold. Firstly, to prevent illness in healthy, and secondly, to treat the disease. As quoted in Organon of Medicine, the homeopath has to function like a preserver of health, and also he has to restore the sick to health. There are a lot of fundamentals that match around between Ayurveda and homeopathy. One of the important requirements for a system of medicine, according to Hahnemann, is curing rapidly and in the shortest period of time. Since relief has to come at the least expense of time, money, energy, and suffering on the part of the patient. I hope you all agree with this. Just now, Dr. Wolfgang had just made a reference of the same, where he said that his cases were showing some good, fast responses. Even the last speaker, she made a reference of the aromatherapy making an immediate response, an immediate reaction. To support this, I would demonstrate a few cases which required quick responses. So that's the first case, which is of Mrs. MC. She was aged 54 years. Under tremendous psychological stress, developed headache, diplopia, squint. MRI showed a lesion in the right paracellular region. Following homeopathic treatment, she felt calm and relaxed with no headache, diplopia, but a residual minimal squint. A 10-year-old long follow-up shows evidence of complete recovery. This was the MRI that was there before the treatment, and of evidence of a small patchy enhancing area in the right paracellular region close to the right cavernous sinus. This was the MRI that was done before the treatment. We treated homeopathically, and post-treatment you can see the noticeable difference. And the impression says a case of en-plaque enhancing lesion in the right paracellular region, right tentorial region, and adjacent to the right cavernous sinus on follow-up shows, when compared to the previous MRI, dated 19/6/2004, there is significant, almost total resolution of the lesion, except for a small enhancing area in the right paracellular region close to the cavernous sinus. There is a significant amount of reduction in the swelling that was shown in the MRI, and symptoms also simultaneously showed total improvement. As I mentioned you, that there was no headache, the diplopia also went off, there was a minimal squint. So we talked to the patient that, you can just get your squint repaired. She says, no, it's just a little small thing. I can just be more comfortable with it. This is another case of mitral valve stenosis. A male patient aged 31 years, diagnosed with rheumatic heart disease and mitral stenosis for 5 years. He suffered from severe dyspnea on slightest exertion. There was hemoptysis, there was paroxysmal nocturnal dyspnea. This is one of the classical signs of mitral stenosis. the paroxysmal nocturnal dyspnea, where the patient just wakes up at night. He's fast asleep and, he just feels totally breathless. So this is a very classical symptom of mitral stenosis. In 2002, the mitral valve aperture shows 1 square centimeter. That's the arrow that's been shown through. 2005, it came to 1.02 square centimeter. 2006, it came to 0.96 square centimeter. That's the mitral valve aperture which goes on reducing in the last 5 years, from 2002 to 2007. He was advised to go for a mitral valve replacement. We started homeopathic treatment, and within 2 weeks, he recovered from his complaints. This was the echo, which was done on 4/10/2007, and the mitral valve aperture showed 0.8 square centimeter. This was the time when the patient was advised to undergo mitral valve replacement. We see that in 2 weeks' time, patient was free of paroxysmal nocturnal dyspnea, no hemoptysis. He had dyspnea, but the grade of dyspnea had gone down. We have 5 grades of dyspnea. So his dyspnea became, he had initially dyspnea on a slightest little exertion, and he would have a breathlessness. Now it was on a moderate exertion that he would become breathless. We did a repeat echography on 23/11/07, and you could see that the mitral valve aperture had increased from 0.8 to 1.1 square centimeter. That's within 1.5 months of homeopathic treatment. At the end of 2 years, the mitral valve aperture had become more wider to 1.28 square centimeter. This is a very interesting and a challenging case of what is known as enteric duplication cyst. It's a very rare sort of a disorder. The cyst was detected at 22 weeks gestation. So it was an during pregnancy on a routine USG. The fetus was detected as having a cyst. The cyst size kept on gradually increasing with increasing age. The infant was about 4 months when she first consulted for homeopathic treatment. She was asked by 2 pediatric surgeons to undergo operation because any time the cyst could burst. And we have a serial reports. This is the report on 32 weeks pregnancy, where the size of the cyst was 1.8 by 1.4 centimeter. The arrow that is shown around gives you the thing is 1.8 by 1.4 centimeter square. So you can see it is 38 to 39 weeks fetus. So intrauterine. This is 4-day. This was the sonography that was taken at 4-day, and the size was increasing. It increased to 2.5 by 1.8 square centimeter. The pediatric surgeons were of the opinion that the baby needs to be operated to avoid any emergency. They had asked for an early plant surgery. And this was 5th month when the size of the cyst was 4.4 by 4 by 3.3. This was the size of the cyst the 5-month baby had in her abdomen. We started the homeopathic treatment, and we found that on the 6th month, the size was reduced to 2.5 by 2.1 by 2.1 square centimeter. That is around 1/8 the size. From what this cyst size was, in 2 months time period, the cyst size had come down to 1/8 the size. And on 22/10/2011, there was complete resolution of the cyst. The previously seen duplication cyst is not visualized. However, a suspicious collapsed cyst, that child is 6 years old now and healthy. I have many more cases to go by. If you can see the slides that I have prepared off, which probably show that this is a nice case of post-viral glomerulonephritis, where the child, 6 years old, was passing frank blood. It was only blood she was passing, and one can see the RBC report, which shows it is more than 500. Within a span of from 28 to a span of 28-12, that is in 4 months' time, she became completely all right. There are serial investigations which we have done to check up progressively to know the course. This child is around 12 years now, and USG reports have been done systematically. She is free of any problems. This is a nice case of cervical polyp with hypothyroidism. I'm afraid I won't be able to. This is a nice case of follicular neoplasm, where a case of swelling in the neck of a male aged 50 years. He was diagnosed with follicular neoplasm. He refused to undergo thyroidectomy. We have the cytological report where it says that suggestive of follicular neoplasm. And here we have the cytopathological report where features are suggestive of colloidal goiter. This is a case of appendicitis where the appendix is well visualized. However, multiple filling defects are seen. It is suggestive of chronic appendicitis. And then we have treated homeopathically. We find that the appendix is well visualized. It is suggested that as practitioners of healing art, we should aim to make the patient's welfare our primary concern. We need to be first physicians, then an Ayurveda or a homeopath, etc. For achieving holistic health, it's time we start integrating the systematic learnings from Ayurveda and homeopathy in combination with transcendental meditation. Meru here has done good quality work in this direction. Maharishi's vision and Meru's efforts for helping suffering humanity can become more and more a reality in a consistent manner through this approach so that mankind benefits from this endeavor. The purpose of this presentation is not to show homeopathy higher up than any other science or a system. The purpose of the presentation is to shift focus from a therapy-centered behavior to patient-centered behavior. We are talking of a patient care. The attempt here is only to probably come down and say that let's shift our thought processes from a therapy-centered behavior to a patient-centered behavior on the part of the physician. To end, let all be happy, let all be healthy. So, sarve bhavantu sukhinaha, sarve santu niramaya. I sincerely thank the organizers at Meru and the Ayurvedic Society for giving me this opportunity. My friend Dipti, who helped me with this presentation, and you, the lovely audience, for hearing me out patiently.
Thank you, Dr. Modi, for
Jai Gurudev.
your fascinating presentation. Actually, your suggestion for patient-centered care is being taken up by the new Maharshi Health Centers for Integrative Medicine, where there's a department of homeopathy, along with the departments of Ayurveda and other systems of natural and traditional medicine, including aromatherapy and many others. So we hope you will be an expert advisor in homeopathy for these new Maharshi Health Centers.
I'd love to be a part of it. Definitely.
Jai Gurudev.
Thank you so much. and Sanjay Modi, you know. So our Prime Minister says, Sabka Saath, Sabka Vikas. Let's all go together, let's all progress. You know, that's what his motto is, that Sabka Saath, Sabka Vikas. Thank you so much.
Motto of Mr. Modi.